Welcome to the NAHA teleconference, brought to you by the National Association for Holistic Aromatherapy. To learn more about NAHA, please visit www. Oh, wait a minute, it's not going. Sorry.
The broadcast is
There it
now
goes.
starting. All attendees are in listen-only mode.
To learn more about NAHA, please visit www.naha.org. The information being presented is not intended to diagnose or take the place of professional health care. Before using essential oils and aromatherapy products, please consult with a professional aromatherapist. Tonight's presentation topic is Phyto-Aromatherapy for Emotional Balance. This educational teleseminar is being presented by Annette Davis. Annette is a clinical nutritionist with over 20 years of aromatherapy experience. She began her aromatherapy career as the secretary of the first American Aromatherapy Association, founded in 1987. She regularly teaches aromatherapy and clinical phytotherapy classes to health professionals and medical students. Annette practices endobiogeny at the Endobiogenic Integrative Medical Center located in Pocatello, Idaho. Annette is also the Customer Relations Manager for Time Laboratories, a longtime, well-respected natural products manufacturer founded by her grandmother, Anne Marie Bueller. Annette is the current NAHA president. To learn more about Annette, please visit her website at www.restorehealth.us. And I'd like to take a moment and welcome Annette to tonight's presentation and thank her for being here.
Thank you, Kelly. I'm happy to be here. So tonight we're going to be discussing, as Kelly said, phytoaromatherapy for emotional balance. This is one of my favorite topics. I've always been a high-functioning alpha girl, and until you really understand what that means, and I'll explain that through the presentation tonight, it's very easy in your life to get used to living with an emotional imbalance that favors stress, for example, and not realize how much it's affecting you in your daily life. As we speak about the nervous system, there are three basic divisions. The first division being parasympathetic, which is rest and digest. The second being alpha sympathetic, which is our alarm system. And the third, beta sympathetic, our action system. Parasympathetic maintains our balance at rest. And if you'll know if you meet a parasympathetic person, because they tend to be very calm and easygoing in nature. What the parasympathetic system does for us is slow the heart rate, relax blood vessels, it stimulates digestion, increases intestinal and gland activity, relaxes sphincter muscles, constricts airways, increases congestion, and clears metabolic waste products. For example, adrenaline and lactic acid, which are created through stress and activity, need to be cleared out of the body, and the parasympathetic helps us to do that. The alpha sympathetic is our notification or alarm system, and whenever a threat to the body erupts, the alpha sympathetic system prepares the body to deal with this threat. It dilates the pupils in order to see the threat, constricts blood vessels so that blood goes preferentially to the brain for quick thinking, and halts digestive and urinary muscle activity. It also increases TRH, which is thyrotropin-releasing hormone, or our brain level of thyroid activity, so that energy can be mobilized. Beta sympathetic activity quickly follows, and that's our fight or flight, where we decide whether we're going to stay and deal with the threat or we're going to run away. Running away, exercise, physical activity is required to resolve a stress so that we can then return to parasympathetic predominance. If you look at the illustration here, it illustrates a cat so that you can understand what we're talking about with the chronic stress cycle. So here you'll see the cat here in rest and digest mode, which is also parasympathetic. And each day we cycle through the various divisions of the nervous system as we deal with stresses in our life, for example. If We have to respond to an alarm. Then we're in alpha state. Then we make that decision. Are we going to run away? Are we going to fight? How are we going to deal with that stress? So the beta sympathetic is the release from the stress. And then we return to our rest and digest state. The problem is, in our society today, we have to deal with stress on a constant basis. Early man used alpha sympathetic or alarm to deal with, for example, a bear that ran out of you in the jungle. You would have to decide, what am I going to do with this? You're going to run away, or you're going to stay and fight the bear. And when that was done, you're able to quickly return to rest and digest mode. But in today's society, we tend to be in a constant state of stress. When we get stuck in one of these modes, such as alpha, then we are never able to resolve it and return to the balance that we were intended to have. So stress does a lot of things to our body, which we'll hopefully understand as we go through this presentation tonight. This is an illustration written by one of the doctors in the clinic where I work, Dr. Bokelman, and it shows what alpha sympathetic activity does in the body. The red lines are stimulatory, and the blue lines indicate that something is being inhibited. For example, alpha stimulates uterine contractions. It suppresses digestive secretions, decreases GI motility, increases sphincter of Oddi activity, pupil dilation, etc., etc. So you can see how when people say that stress affects your body, it is absolutely a fact that it does. It affects so many areas in our body, as you can see by this quick illustration on this chart. When we're subjected to a stress, our body needs to be able to adapt. Adaptation is a change that takes place in the nervous and hormone systems as the body keeps itself alive in the face of stress or aggression. If our body fails to adapt for whatever reason, then our organism, our body, would cease to exist. So this is a really important part of our health, the ability to adapt. In acute stress, a short-term change puts the body into overdrive, allowing it to deal with the stressor. So, for example, we're running, we're working hard, taking a nap, etc. In a chronic stress situation, our body is forced to deal with a new balance. That causes a change in the terrain, making the person more susceptible to illness. The more resources that we have to use in dealing with the stress, the more that takes away from the other system, the other metabolic processes that the body is required to deal with. So we take, for an example, stress associated with work. Our acute stress, preparing for a webinar, for example, we use that, lasts for a few days. Your body will go into overdrive and give you increased physical and mental capacity and eventually return to your previous resting state. It's a temporary demand for fuel. A chronic state, the organs are not allowed to return to a resting state, so they have to establish a new balance in the overdrive state. Some examples of that might be a high-pressure job where your stress never goes away. You're under a deadline pressure 24/7. Being in an abusive relationship, for example, would be something that would be a stress that's ongoing that never resolves itself. Being in any kind of conflict, be it mental or physical, can cause us to be in establishing a new state of balance in the overdrive state. A disease, a severe disease such as cancer would be another example of something your body has to deal with on a constant basis and isn't allowed to go back to its resting state or para. So what's the problem? After months or years of being in overdrive, our organs wear down and no longer perform their functions properly. This can lead to mood disorders, anxiety, depression, insomnia, chronic fatigue, immune dysfunction, inflammatory states, decreased sexual function. These are just some examples of the many things that can happen to us if we're subjected to a chronic state of stress. Terrain is a specific individualized balance of our body. And why do we talk about terrain? It's really important to understand each person's individual balance if you want to help them become well. And there are some things that we can do generally. For example, we know that lavender is a really good choice to help people through any kind of stress. But if we're able to understand the terrain of the individual that we're working with, or our own terrain, if we're working on our own health, then we can do a better job of choosing a treatment that will be effective for ourselves, for our clients or patients, whoever it might be that we're working with. So there are a number of factors that affect our terrain. There are our genetics. In utero exposure, hormones have been shown to pass through the placenta to the fetus that's developing. So a baby that's born whose mother was extremely stressed can already have, for example, elevated adrenal hormones when the baby's born. And so I hate to admit it, but sometimes people are right, it's all mom's fault. And I have kids, so it really is. I mean, we say that jokingly, but even though, you got to get over it and it's not all mom's fault, some of the problems that we experience in our life really did start in utero with the hormones that we were given by our mothers. So it's really important to understand when we take a history for our client or our patient, whoever it is that we're working with, to understand if that information is available. Was mom under stress? What kind of things was she dealing with in her life? Was she on medications? And all those kind of things can help us understand what started this process in the client in front of you that's having a problem with emotional imbalance. Our traumas, our thoughts, our fears, our nutrition, sleep habits, bad habits like smoking, all affect our terrain. And our terrain then affects the way our body chooses to adapt to stressors. And it's one of the reasons why two people can experience very similar stressors and end up with very different symptoms. Another good example of this would be if we were all in a room together and this was a live seminar that was being given, all of us would be subjected to the same germs that were airborne, whether it be a flu virus, a cold. We would all be subjected to those, and yet only a small handful of people in the room would develop the illness that they were exposed to. Each individual person and their terrain determines how they are going to react to a stressor that is subjected to their body. Some people can be exposed to all number of things, not catch a thing, they're never sick, and then you have people who they simply get sneezed on and they're sick. And so it's really important to understand, why is this happening? What can we do to support this person's system? And one of the keys to understanding that is understanding their terrain, their individualized balance for their own body. So there are aggressors that can impact our terrain. Microorganisms, for example, such as bacteria, fungi, viruses, yeast. Environmental pollutants play a role. When we're exposed to toxic chemicals, our body has to deal with those. Our liver is forced to detoxify them. And some people have a very strong liver that's very good at detoxifying, and other people, for various reasons, their liver can be compromised and they don't detoxify well. There are ingested aggressors, such as medications, poor diet, especially those high glycemic foods. Trauma, emotional trauma, physical trauma, such as illness, surgery, deprivation, starvation, dehydration, cold, excess sugar, things like abuse. When we work with patients that have symptoms like, for example, chronic fatigue or fibromyalgia, as we dig in and work with our patients and get their history, those that suffer from the syndromes that are really difficult to deal with and that classical medicine doesn't have good answers, such as fibromyalgia, most of the time they have dealt with the severe emotional and physical trauma, such as abuse, in their earlier life. So what are the diagnostics that we can use? Obviously, we want to detect where the imbalances lie and which organ systems can we support. And if we're dealing in a clinical situation, that gives us an advantage because we have access to things like lab work. When we're not, there's still other things that we can use and tools that we can rely on to help us understand what is going on with that particular person that we're trying to help. So a history. And our history should start way back before they were even born, like we talked about earlier. What was going on in mom's life? What was going on in the home environment? We look at physical signs. One of the strongest physical signs of high alpha sympathetic activity is cold hands and feet, feeling cold and not being able to get warm. Remember how we talked about constricting blood vessels when we're in alpha sympathetic mode so that the blood can go preferentially to the brain for quick thinking. Well, that has a side effect. While our brain is nourished and able to think quickly, the blood is restricted from our peripheral tissues, and so our hands and feet tend to be cold. Even when it's warm outside, sometimes you'll shake somebody's hand and you'll feel that their hand feels very cold, or if you feel their feet, they're very cold. And one of the reasons for that is they are stuck in chronic alpha mode. Alpha and beta balance each other out. So you'll always have alpha, beta, para in balance, trying to achieve a state of balance that will work well for that particular person. So you'll see people with nervous system imbalances that can have all spectrum of different symptoms. Your alpha dominant people will have the cold hands and feet like we talked about. Your para-dominant people will tend to have your sweaty hands and feet. And the people that are high beta tend to talk incessantly. When they're kids, they're the ones that had tantrums. When they're older, they're the ones that are very assertive. You go to the store and the lady that comes up and takes your place in line and, you know, that sort of thing, road rage, those are your beta people. And so you can, as you begin to become used to the different divisions of the nervous system, you start to meet people and you'll never think of them in the same way. You'll meet somebody in the subway or the train station, you'll be able to say, ah, that's an alpha person right there. That's a para person right there. That's a beta person, you know, the one yelling because the train is late and so forth. So we look at the history, we look at the physical signs that we just talked about. And there are many. If we had more time tonight, we could go through a lot of different physical signs that can give you a clue what's going on with that person and their balance and their terrain. We look at their symptoms. A high alpha person tends to really get a lot of things done, but at the same time often has things like sleep disorders, trouble falling asleep or waking up when they're sleeping, waking up early in the morning and not being able to go back to sleep. A high para person will be the ones that has a hard time getting themselves off of the couch to do things because they're in that rest and digest mode. They're the kind of people who just want to go home and chill and cuddle up to a good book or watch TV and leave everything else for another day. Your high beta people are the ones that are constantly finding something to argue or fight with somebody else about. And the more you learn about this, it's pretty amusing to watch people and their behavior and try to determine, just sitting there in the airport waiting for a flight, what kind of people are surrounding you. And then you start to recognize that, understand that, and then you know what you can do to help. So in our diagnostics, we'll look at a prenatal history, infancy and early childhood, family history. Genetics certainly play a role in the imbalances that we're born with, personality traits, and family circumstances. We'll also look for indications of current hormonal balance. Ask questions about menstrual cycles. Are they fatigued? Have they had weight gain? Do they have cravings? And indications of the current nervous system balance, temperature, skin moisture, bowel function, pupils, like we talked about already. Some of the physical signs we'll look for are racing heartbeat, hypertension. Are they easily startled? If they're the kind of person who somebody says boo and they jump through the ceiling, that's a high alpha person right there. Muscle tension is another one. And a lot of us learn to just live with muscle tension. We'll have pain in our neck or our shoulders or other areas, our lower back, and we just get used to it and don't realize that we could help that and get rid of it if we're able to help to balance our nervous system. Aches and pains, cold extremities, we keep coming back to that one, but it's such a big one. Pupil size, alpha dilates our pupils and para constricts. An increase in facial hair, which is also a sign of stress, weight gain, edema, and so forth. So some of the symptoms of having a nervous system imbalance would be difficulty coping with stress, anger, irritability and mood swings, being easily brought to tears, withdrawing from others, anxiety, sleep disturbances, fatigue, chronic sadness, depression, headaches, brain fog and difficulty concentrating, feeling cold, and even hot flashes. So when we're able to get lab work, we run something in our clinic called the biology of functions. And it takes the lab work to a new level. It starts with some fairly basic blood tests, which is a blood count, chemistry, cholesterol, proteins, and a few lesser known labs. And we're able to run them through a special software that was developed by a group of French medical doctors that we work with. And that software looks not just at the straight lab values, which are almost always normal. Even when we see somebody that has severe imbalances, their classical lab work will come back completely normal. We might see things like liver enzymes elevated once in a while or cholesterol elevated. Somebody's anemic, we'll see that in their blood count. But other than that, we don't get a lot of really useful information from classical lab work. So with this biology of functions that we use, it looks at the ratios of the various lab work so that we can understand a hormone balance and understand a lot more about the patient. So when that is an option, lab work is extremely helpful. Our treatment goals are focusing on the person as a whole. We're going to correct multiple balances simultaneously rather than focusing one at a time. And our aim is to treat the terrain. We're not just treating symptoms. We want to rebalance the nervous system, rebalance the hormonal system, and allow the body to take care of itself. And one of the keys with this is to avoid treatments that overwhelm our body's symptoms. You'll hear sometimes people do crazy detox, for example, that makes them feel really sick. And that would be a heavy-handed detox that causes the body to lose the toxins too fast, makes you feel sick. When you're looking at the whole person and treating holistically, you never want to do that. Our goal is to gently nudge the body back into balance, and we do that by very low dosing of the treatments. Essential oils are key, and they're so useful. I'll explain a little bit about that later. But you want to use frequency of dosing and very small doses to be able to nudge the body back into balance and allow it to take care of itself. So how do essential oils, herbs, and other supplements help? They nourish, calm, and balance the nervous system, making it easier to cope with the stress. So instead of having the negative vicious cycle of toxins, stress, toxic people in our lives, deadlines, and so forth, we create a positive vicious cycle where by nourishing and calming our bodies, particularly our nervous system, everything else tends to become in better balance. By balancing our nervous system, even if we weren't giving essential oils and herbs that helped with a hormone imbalance, you would tend to see that improve just because you improved your nervous system balance. So that positive vicious cycle is something that we can realistically hope to achieve when we're using gentle, natural treatments such as essential oils, herbs, and supplements. We support the adrenals, providing energy to cope. When we have a coping problem, usually it's because we have exhausted adrenals. Our adrenals produce a number of hormones that help us deal with the stress. When we're in that fight or flight beta mode, our adrenals surge epinephrine, norepinephrine, cortisol to help us be able to have the energy to cope. Over time, the adrenals become exhausted as they're forced to continually secrete hormones that are meant for that bear that jumped out of the woods, not for all day long, every day trying to cope with stress in our lives. So if we support our adrenals and nourish our adrenals so that they don't become exhausted, it'll be a lot easier to cope in the face of stress. We seek to reduce inflammation. Most essential oils are anti-inflammatory. We seek to reduce oxidation. Again, there are a number of essential oils that studies have shown their superior ability to fight oxidation. One good example of that is rosemary. I saw a study just the other day, and as manufacturers and those importing these oils, rosemary has become increasingly difficult to get because the food manufacturers have figured out how amazingly effective it is at low levels to avoid oxidation. So it's being included in a lot of foods, such as pet foods, for example. A lot of the better quality pet foods now contain rosemary, and it increases the shelf life considerably of the pet food and the quality of it. A lot of other foods, if you start to be a label reader, you'll start to see rosemary appearing in a lot of foods. At a very low level, it's very effective. And many essential oils are that way. They're so amazing as you start to study them and learn what they can do for us in our body. We want to balance hormones. And again, we're not talking specifically about hormones today, but it all plays a role in our balance. There are a number of essential oils that are so fantastic for their hormone balancing ability. Essential oils help to detoxify. Rosemary, again, we're talking about rosemary. It's such a fantastic oil. It's able to help detoxify the liver, as is helichrysum, another fantastic essential oil for detoxifying the liver. And there are essential oils that help to normalize blood sugar. When we're dealing with a stressful situation, it affects the way that we utilize insulin in our body. It affects our blood sugar. And over time, we can have chronic disorders that develop as a result of the stress that can cause other diseases later in life, such as diabetes, if we don't deal with them. So here are some of my favorite essential oils and herbs for nervous system balance. Lavender, of course, always comes out on the top. One thing that's really important to note about lavender, though, there's a lot of lavender out there that isn't real lavender. The lavender that has synthetic linalool in it, for example, or lavender that's been blended with other species. So when you obtain lavender, be sure you're getting the real thing. It is such a key. In the clinic that I work in, I would say 90% of our patients have lavender in their treatment in one way or another, just because it's so good at the many things that it does. But it's really important, because you're relying on this oil, that you have a genuine essential oil that you're dealing with. That's the same with all the oils, but some oils are very much more prone to not be genuine, and lavender is one of those. So it's one of the top oils being sold as a genuine oil, and it's not. Petitgrain, one of the lesser known essential oils perhaps that maybe not a lot of people use on a daily basis, happens to be a superior nervous system balancer. It's very good at reducing alpha sympathetic activity, and it doesn't make you sleepy. That's one of the nice things about a lot of these essential oils. Because they're affecting the nervous system balance, it's not like taking a sedative that's going to make you tired, make you so you can't operate heavy equipment or drive. The essential oils, for the most part, that we have here are able to help balance the nervous system, help you chill out without making you tired. Bergamot is another one that maybe you don't use on a daily basis that is absolutely fantastic for balancing the nervous system. It also helps the brain function better, function properly. So I really love bergamot, one of my favorite oils for nervous system balance. The chamomiles, either German or Roman, both work really, really well for nervous system balance. They're also very anti-inflammatory and help to support the organs of elimination, the emunctory organs. So chamomile is a great choice. Mandarin is another good one. You're going to see a lot of citruses as we talk about balancing the nervous system. Citrus oils are key, very, very important. Also tangerine, grapefruit, and orange. And the nice thing about these oils is they tend to be fairly inexpensive and yet very effective in helping to balance the nervous system. Mentioning the citrus oils, a few cautions that you want to be aware of. Some of the citrus oils increase the photosensitivity of your skin. So if you're using them topically, which is a very good way to use essential oils, you need to make sure that you know which ones increase the photosensitivity of your skin, and not to go out in the sun if you've used them in a lotion or a massage oil, for example. Chamomile is really good if you're going to be having your skin exposed to the sun. It's very good, and it doesn't affect that. So it's one that's really nice to use. And all of the essential oils mentioned here can be used topically. Always want to dilute them, of course, and orally if they're properly diluted. Lemon is another good example of essential oil that balances the nervous system. Lemongrass as well. Clary sage. And one of the nice benefits of clary sage, it not only balances the nervous system, but it also helps to balance hormonal system as well. Frankincense, you want to make sure you're getting one that is sustainably produced. But frankincense is a fantastic essential oil on so many levels. Helps to balance the nervous system, highly anti-inflammatory. Studies have shown that it's anti-cancer. Just can't say enough about how amazing frankincense is. Marjoram, and you want to make sure that you're using the sweet marjoram, is a nice calming oil. Jasmine, rose, those are your more expensive oils, so you can't always use those, but when you can, they work very, very well. Ylang Ylang, and one of the nice things about Ylang Ylang too is it's so good at increasing self-esteem, and it also helps with sexual dysfunction, which is one of the things that tends to come out about when you're under an increased amount of stress for an extended period of time. Angelica is another one that's really good. Hops is a very good choice, and it can be used. There is an essential oil, although it's harder to get. It can also be used as a mother tincture, bulk herb, or dry extract. Passion flower, tilia or lime tree, hawthorn, California poppy, motherwort, yellow sweet clover, lotus or bird's foot, Vitex agnus castus, chaste tree. One of the interesting things about a lot of herbs that help to balance the nervous system, they tend to balance the hormonal system at the same time, and that's particularly true of chaste tree. Valerian is another one that's really good. And the interesting thing about valerian is it also helps to increase parasympathetic activity. And there aren't too many plants that are able to do that. So if you have somebody who has a really hard time transitioning into parasympathetic, which is the rest or digest aspect of our nervous system, then valerian is a really good choice. So I have here a sample topical blend of something that we would use very often as we work with clients or patients. And very simple, easy to use, equal parts of each of lavender, petitgrain, bergamot, and chamomile. And some good ways that you could use this would be undiluted in a diffuser or on a tissue for inhalation, or you can dilute it and carry it and use it topically for massage in the bath, etc. Now, one mistake a lot of people tend to make when they first start using essential oils is putting essential oils straight in the bath. I remember that was one of the first mistakes I made, and that was putting orange oil directly in the bath water. I'm sure some of you have done that, and you'll have empathy for my situation. They can really, really burn if you just put it straight in the bath. Oil and water don't mix, so it's really important to take, one of my favorite bases is just to take a natural bath gel and really mix a few drops of the essential oil into the bath gel and put it in the bath. That way it'll be emulsified in the water and you won't cause yourself the irritation. Baths are a fantastic way. The warmth of the water, the essential oils that you use in the bath can be a really, really good way to wind down at the end of the day when you've been in a high stress situation. Here's a sample oral blend, which, as you can see, the essential oils are highly, highly diluted, and I can't stress this enough. It's so important when you're using essential oils internally that you're working with somebody who knows what they're doing and that you're also highly, highly diluting them. The dose here of essential oil that you would be getting is less than 1 drop in the 2 cc's that you're going to take. So you have several tinctures and glycerin macerates here. The first one being lime tree, and that's a gemotherapy glycerin macerate. And then the tinctures that we chose for this particular blend would be passion flower, bird's foot, and lemon balm. And then the essential oils, lavender, petitgrain, bergamot, and Roman chamomile. This is an extremely effective and safe blend to use for a lot of different nervous system complaints. It tends to cover the full spectrum of every imbalance that you can think of and will be very helpful. It's always better to do something individualized for each patient, but this can be a quick go-to that can be really helpful, something along this regard that can be very helpful for anybody who's experiencing stress. One thing that's so nice about the essential oils is how quick they work if you need them in an immediate situation. If you're having a panic attack, for example, you can dilute some lavender, petitgrain, bergamot, chamomile, whatever you have on hand on your kitchen counter or in your medicine cabinet that is a calming essential oil. You can mix it with a little olive oil or whatever oil you have in your kitchen. For cooking, grapeseed oil works well, olive oil works well, sesame oil, the things that we tend to have in our cupboard. Coconut oil is another one that works really well. You can just mix a drop of each one, put a little bit under your tongue, and then rub it on pulse points, and you'll be amazed how quickly you'll start to calm down. With children who tend to be high stress or have trouble taking tests, another really good thing that you can do is send them to school with a little bottle of essential oil that's pre-diluted. Those roll-on bottles work really, really well for this. So you can put a few drops of lavender, whatever you like, and whatever your child likes the smell of. Just mix those into a base, such as olive oil, grapeseed oil, coconut oil, whatever carrier that you like. And if they have test-taking anxiety, you can have that ready and just teach them to roll a little bit on their wrists and inhale a little bit from their hands. And it's amazing. I use this for my kids at school, and their teachers always ask for some. Like, oh, what was that? Your child used it. It's so amazing. Can I have some? And I've ended up taking blends to teachers at school, and they absolutely love it. Had one teacher a couple of years ago who had a really uptight class, and my child was in that class, and she got permission to start diffusing. It was just a blend of lavender and orange in her classroom during tests, and she reported what an amazing result that had. And of course, we can use that for ourselves too. This isn't just for the kids taking tests or those in college. Those of us who end up having stress in our lives for whatever reason, if we start getting in the habit of having these calming essential oils with us, there's so many ways that we can use them to tackle whatever stress we're under. If we're in a stressful relationship or an abusive relationship, getting used to using essential oils in massage, for example, before you go to bed or in the bath. There's so many different ways that you can help to calm yourself and those around you using essential oils in very many different ways. Even when I do dishes, I like to put some drops of, I have an essential oil blend that I love a lot that just has lavender and vanilla and some other things in it, and I put a few drops in the dishwater. As you're mopping your floors, why not put a few drops of an essential oil blend in your cleaning solution, whatever it is you're using to clean. You can put a few drops on a washcloth when you put it in the dryer. Just having the calming essential oils in your environment can make such a huge difference on how you deal with stress that day. There are many, many different ways to use them that are so effective, both in a clinical setting, in a family setting, in a client setting. If you're a massage therapist, for example, just incorporating the essential oils into the massage will make an amazing difference. No matter what profession you're in, or if you're simply wanting to use essential oils to help with your family at home, understanding the person that you're working with, what led to the stress that they're dealing with, can help you choose essential oils that can be so helpful. So just some cautions here. I think I already covered these, but just that we want to be sure to dilute. I can't stress that enough. There are very few instances where you would use an essential oil without diluting. And then there's, of course, the NAHA safety page, which can give us additional recommendations for using essential oils safely and effectively. So this is a little cartoon that I really liked. I'm learning how to relax, doctor, but I want to relax better and faster. I want to be on the cutting edge of relaxation. And aren't we in that kind of society? We just really are. Okay, I want to leave plenty of time for questions.